Okay, guys, time to get real about a condition that's not exactly comfortable to talk about. In fact, it can be a real pain in the, well, yes, hemorrhoids. And Dr. Paul Broderick with Franciscan Health is joining me now to tell us everything we need to know. We're talking symptoms, what to look for, and how to treat them. Thank you so much for being here.
Hey, well, thank you, Dustin. And I wanted to thank you and the THR team for hosting this, for having these conversations. It's different to reach men than it is reaching women. Women are easier, they engage, they're curious, they listen to their body, they listen to their providers, they act on it.
We tend to ignore
Men
or
don't.
stall. Exactly. Right.
And so we can, and now the check engine light comes on, or the low pressure sensor on your truck, on your tires, we're on it.
So,
but we have ways of rationalizing such things, and that can be dangerous.
Absolutely. Well, one of the important things to talk about today is hemorrhoids. Let's start off with a basic one. What exactly are they for those who may not have dealt with these before?
Right. So it's a normal anatomical structure. Okay, so people say, oh, I never had them. Well, you didn't know you had tonsils until you had tonsillitis.
Good point.
Yeah, and so you get over the episode, the tonsils are still there, but they're not inflamed, and so it's anatomy to have them. And so they're vascular cushions that are there at the outlet of the GI tract. And a number of things can work to get some things irritated and can really be kind of miserable sometimes and scary.
Tell me, what are some of those things that irritate them and cause problems?
Yeah, there's a bunch of things. Often, a lot of things boil down to some lifestyle, some choices. We have a lot of processed foods. We don't have much fiber in the diet. There's things such as straining, whether it be on the toilet or it's just your job that maybe you should lift smarter and not stronger. But we're men, we're gonna.
So straining can actually cause
straining, puts pelvic pressure on the pelvic floor. So somebody working big muscle groups at the gym could be a bit of an issue. Oh, I've been doing this for all these years. Yeah, you've been doing it for all these years. And so getting the dietary fiber, hydration. Hydration is very important. Common things, as it doesn't pertain to men, but pregnancy for women is real common. It's the pressure in the abdomen. A significant factor, and it tends to be more of a masculine, one of many masculine faults, is spending too much time on the throne, okay? And so, somebody gets in there and either for whatever reason, they're spending
scrolling on your phone, reading.
Scrolling, and, we get it, it's quiet, and sure, you go down some rabbit hole of memes, and I thought about, that what's really kind of hot now is, you guys know who you are, but my rule of thumb on that is you don't want to spend any more time there than you would at the portalette at the Colts game.
Okay.
Get in, get out.
Okay, well, that's a good reminder. Interesting.
Yeah, it's a big factor.
So how do we know when there is a problem?
So the most common source of some bright bleeding is internal hemorrhoids, okay, and not necessarily painful. Okay, those will tend to bleed. If there's pain there, pain's a problem, okay, whether it's your elbow or your ear. Pain's something that shouldn't be, so some swelling, some pain. But the bright red bleeding is, well, any bleeding, let's say, is a problem, and it deserves to be evaluated, okay? Again, men tend to put it off, again, most any given day, someone says, the spouse is there, and he said, this has been going on 6 months? Yeah. And so, it deserves to be evaluated. At least bring it up with your primary care physician. Address some of the dietary and things that we talked about.
Okay. How do you diagnose them?
So, talk to people. How long has this been going on? What's going on? What are you experiencing? Sometimes, people are blaming hemorrhoids, and it's like, this doesn't sound like that.
Okay.
And sometimes, it fits. Okay. So we talk about things, physical exam, history, physical exam, in the office, it's kind of embarrassing. Done properly, no, it's not going to be anything miserable physically. But you can take a look. what kind of inflammation, swelling, et cetera, might be present.
And what kind of treatment options are there out there?
So several. First, the foundation. I know it sounds broken record, but the hydration, the fiber, the minimizing toilet time
Okay.
really goes a long way. But then some topical medications for some inflammation. An episode that something swells and some topical inflammation, maybe some time in the tub to help soothe the backside. That goes a long ways. Those people often don't get to me. They've resolved, they've got 100 other things they'd rather do.
Yeah.
And so I see those that have either had repeated needs to address that, or it's not getting it anymore. And so then we get into some non-surgical and some surgical options.
So this sometimes can escalate to surgery, huh?
Certainly, and largely it's like maybe, let's say, major auto repairs is some bit of neglect. We've let this go, we've let this go, we've let this go. Now this is where we're at, and this is unfortunately the tool we have to deploy. But there are non-surgical treatments that, a few seconds in the office, you don't miss work. That's man, I'm not going to miss work. I'm the provider. Don't miss work. Go about your way. Common one's called hemorrhoid banding, hemorrhoid ligation. Another is called infrared coagulation and sclerotherapy, which is it's essentially a micro scarring to shrivel some vessels. Yes, it sounds scary, but anybody that's had that, they're like, that's it.
Man, it makes a difference.
Huge difference.
So what I'm hearing you say is don't wait, don't delay. First of all, diet, right? Stay hydrated. But also if you develop symptoms, treat them or come see you.
Treat them, bring up their family physician, sometimes the specialist. And excuse me, but I'll go off just here a moment.
Sure.
As I had spoken earlier, I did want to express to people the importance of people that getting constipated with the GLP-1s. Okay, awesome medications. I've had patients for years. I didn't recognize them.
Yeah.
They come in, they're looking great, they're feeling great. Well, some people can experience some significant constipation, so not a day goes by, even if they're not having issues. I'm saying you've really got to pay attention to these things, some stool softeners, because it can be fine until it's not. And then when it's not, there's a price. And boy, if someone's halfway to their goal weight, goal A1C, whatever, and that derails it, that's a shame. So we're going to be seeing more of that in the next few years and beyond. And so
sure, with the increased use of GLP-1s.
People need to know that. It's an amazing medication. I don't think we know yet all of its benefits. But
Dr. Broderick, thank you so much for being here and helping us understand it and talking about something that's not easy to talk about, but certainly very important.
yeah, again, appreciate your family here at THR for hosting this conversation.